Assalamu alaikum. Our lecture today about arrangement of posterior teeth. Correct placement of posterior teeth is important for the mastication ability, retention, and stability of both dentures. Prior to arrangement of posterior teeth, we must understand some of the following definitions or concepts which is related to posterior teeth arrangement. The first definition or concept is curve of spine. It is imaginary line represent the anterior-posterior curvature of the occlusal surfaces of teeth, beginning at the tip of mandibular canine and following the buccal cusps of premolars and molars, continuing to the anterior border of the ramus of the mandible. The correct orientation of occlusal plane will optimize aesthetic function and occlusal balance. The second concept is Christensen's phenomenon. It is a space created at the posterior area, produced in the natural dentition or between the opposing posterior part of occlusal rims when protruded of the mandibular jaw. That's mean posterior open bite. To compensate the posterior open bite during protrusive movement of mandibular, the compensatory curve should be made. Compensating curve. The anterior, posterior, and mediolateral curvature, which produce during lateral movement of mandibular jaw in the alignment of the occluding surfaces and incisal edges of artificial teeth. This is used to develop balanced occlusion. We have two types of the compensating curve. We have the anterior-posterior compensating curve, and the second one we have the mediolateral compensating curve. Curve of Wilson, lateral curve. It is a part of the compensating curve, extend mesiolaterally from one side of the arch to the other side. This curve compensates the opening that occurs when a lateral movement of mandibular jaw is made. Arrangement of the mandibular posterior teeth. As we mentioned before about the arrangement of the anterior teeth, there is a guidelines used during arrangement of anterior teeth. Also, in the arrangement of the posterior teeth, we have guidelines should follow. The first line is draw line which represent the crest of residual ridge, which extend from the tip of the canine to the middle of retromolar bud. The central grooves of mandibular posterior teeth should centered according to this line. The line extends from the tip of canine to the upper two-thirds of retromolar bud, which represent the occlusal plane, will determine the height of mandibular posterior teeth, which should arrange not higher than retromolar bud level. The first tooth arranged in the posterior teeth is the mandibular first premolar. The tooth should be set perpendicular to the occlusal plane. The tip of its buccal cusp should be 1 mm below the occlusal plane. The central groove should be over the center of ridge. The second tooth is mandibular second premolar, arranged with the same criteria used in the mandibular first premolar, which is include 1 mm below the occlusal plane. The next posterior teeth is the mandibular first molar. Here we divided the tooth in two parts. The mesiobuccal cusp should be 1 mm below the occlusal plane, and the distobuccal cusp is ½ mm below the plane. The last posterior mandibular teeth is the second molar. Also, we divided in two parts. The mesiobuccal cusp is ½ mm below the occlusal plane, while the distobuccal cusp touch it. I mean the plane in order to give the anterior-posterior compensating curve. The mandibular first and second molar should be arranged with a slight lingual inclination to give the lateral curve, as we say the curve of Wilson. Arrangement of maxillary posterior teeth. These teeth will arranged according to the centric occlusion relation to the mandibular posterior teeth. The first tooth is maxillary first premolar. The buccal cusp should be seated into the buccal embrasure between mandibular first and second premolar. The lingual cusp seated into the occlusal embrasure between the same teeth. Maxillary second premolar. The buccal cusp should be seated into the buccal embrasure area between mandibular second premolar and mandibular first molar. The lingual cusp seated into the occlusal embrasure between the same teeth. Maxillary first molar. The mesiobuccal cusp should be seated on the buccal groove of mandibular first molar, and the mesiolingual cusp should be seated into the central fossa of mandibular first molar. Maxillary second molar. The mesiobuccal cusp should be seated on the buccal groove of mandibular second molar, and the mesiolingual cusp should be seated into the central fossa of mandibular second molar. Common errors in arrangement of teeth. First one, placing mandibular anterior teeth to labial inclination to meet maxillary anterior teeth. Second one, midline shift of anterior teeth. Third one, edge-to-edge contact of anterior teeth. Fourth, failure to make the canine as turning point of the arch. Fifth, failure to establish the occlusal plane. Sixth, placing the mandibular posterior teeth more lingual inclination, which caused tongue interference and mandibular denture displacement. And the last point, placing the tooth on maxillary second molar on maxillary tuberosity. Thank you.